Hello and welcome to the Alliance for Hope International Affiliated Centers webinar series. My name is Rayanne Passantino and I am the Assistant Director of Family Justice Center Programs for the Alliance. I'm excited to host this series that showcases each of our affiliated centers by giving them a chance to share information about their sites and the work they're doing in their communities. For more information about becoming an affiliated center or creating a center in your community, please visit our website at allianceforhope.com. And now I have the great pleasure of introducing Julie Cliff Nicholson, who will introduce herself and take you on a tour of her center. Take it away, Julie.
Hi, everybody. I'm excited to be with you today. As Rayanne said, my name is Julie, and I am honored to be the coordinator of the Buncombe County Family Justice Center. I came into this role having been a managing attorney in our legal services partner agency for several years, representing victims of domestic and sexual violence. And when our community began to come together to improve our response to domestic and sexual violence, I was really excited to be at the table and be a part of the process of transforming the way that we respond to survivors and hold offenders accountable. This work really started for us in 2014 when our community tied for the second highest rates of domestic violence homicides in the state of North Carolina. It was really a wake-up call to us, and community leaders came together to look at the impact that domestic violence was having on our community. With the work of the Jamie Kimball Foundation out of Charlotte, North Carolina, we identified that there is an estimated 3,437 incidents of domestic violence in our community every year, and that costs taxpayers $6.7 million a year. When we saw those numbers in black and white and recognized that underneath all of those homicides, domestic violence was impacting our neighborhoods and our schools and our workplaces and costing us substantial taxpayer dollars, we knew that an investment in coming together as a community would improve the safety of our community and improve the well-being of our community members. So we began to implement what we call our coordinated community response. We came together to improve our cross-system dialogue, learn from each other more about the services each of the different partner agencies offered and how we could work together better to hold offenders accountable, to improve services to survivors. We engaged our community by utilizing the Enough campaign, where community leaders stood up and said enough. Our law enforcement partners, the Blue Ridge Roller Girls, faith community leaders were all part of a poster campaign that said that Buncombe County does not tolerate domestic and sexual violence, which helped us really increase awareness within the community. We've also done some work around identifying and intervening in the highest risk cases. We've implemented the Maryland Network's lethality assessment protocol, where law enforcement officers respond to the scene and do a lethality assessment. And when cases score high on that lethality assessment, survivors are connected immediately to our domestic violence prevention agency on that scene. We've also increased our efforts around offender accountability, increasing batterers intervention, increasing investments in our special prosecutions unit so that we can increase prosecutions of domestic violence crimes. And we came together to improve survivor services. We used the story of a woman named Sophia, who had experienced domestic and sexual violence and who had also experienced whose daughter had also experienced child abuse at the hands of her partner. When we looked at what we as a community expected Sophia to do in the first 3 days after that incident, we recognized that Sophia had to navigate a fragmented system and that we had to do better. When we mapped her experience, this is what we saw.
In the first 3 days after an assault, a survivor seeking help filled out 61 forms, traveled 8 times, made 5 phone calls, talked to 21 people, waited 12 times, received 30 referrals, and some survivors never got help. Now, survivors of domestic and sexual violence, child abuse, and elder abuse can find help at one safe place, the Family Justice Center. We walk the path to strength, safety, and hope with you.
In this work, one of my favorite quotes has been a quote by Dr. Maya Angelou, and it is, "You do the best you can until you know better. And when you know better, you do better." After we saw that and we identified the Family Justice Center model, we knew that we as a community had to do better. So our partners came together to create the Buncombe County Family Justice Center, where we have law enforcement, nonprofit partners, child protective services, the district attorney's office, civil legal services, and child care under one roof. The Buncombe County Family Justice Center opened in July of 2016, and we moved in together in a building where our child protective services and adult protective services already were located. It is within the corridor of service right downtown, directly across the street from our courthouse. This is the entrance, and we worked hand in hand with our group of survivors who helped provide us input about how we design the Family Justice Center. One of the very first things that they said was that we needed to add an awning to the building to make it what they called human size. So the warmth of the entrance was really important to our survivors. When survivors walk in, they come into our lobby and are greeted at our reception desk. The first person that they talk to is someone that works with either Helpmate or Our Voice. Helpmate is our domestic violence prevention agency, and Our Voice is our sexual assault response organization. And those two agencies serve as the centralized intake people for our Family Justice Center. Survivors are quickly escorted out of the lobby because the lobby is open to the public and into our intake area and one of our client dens. We have 4 client dens that, as you can see, were designed to look like small living rooms instead of offices, but also have a desk available for our professionals to bring in their laptops and be able to take notes. Survivors are offered a snack, a cold glass of tea or cup of coffee, and they sit down with an intake specialist who can talk through what resources are available at the Family Justice Center, who they might want to connect with, and then the professionals that are in the building can come sit down with the survivor in the den. She can do a criminal report there. She can begin the intake for our domestic violence shelter, which is located in a separate location. She can talk with a civil legal aid attorney about custody or getting a domestic violence protective order. And if she wants, she can fill out all of the forms for a domestic violence protective order before walking across the street to file those at the courthouse. This is our children's den where kiddos can hang out while their parent is accessing services at the Family Justice Center. One of the things that we really love is you can see up in that corner that camera which links to the monitor in the den. So mom can be in the den, see her kiddos hanging out in the children's den on the monitor, know that they are safe and sound. We have counseling, legal services, case management, all of those ongoing services that clients may need. This is our internal waiting area for clients that have appointments to see a counselor or check in with their attorney. And then you can see one of our counseling rooms as well. As we designed the Family Justice Center, it was really important that structurally we respect the confidentiality of survivors. So all of our counseling rooms are heavily soundproofed, and we also have white noise throughout the building so that confidentiality can be preserved. This is our forensic exam clinic on site. Mission Health, which is our hospital partner, provides forensic medical exams on site at the Family Justice Center for people who have been sexually assaulted and for victims of domestic violence who have the opportunity to have their injuries documented. This has been really important as we've focused on some strangulation work, the opportunity to talk with a medical professional about the long-term consequences of strangulation and the increased danger that strangulation shows has been really important for our survivors. This is a picture of our law enforcement wing, where we have our local Asheville Police Department and our Buncombe County Special Investigations units both on site. We have a small evidence room as well. So now our law enforcement officers can walk across the hall and receive the SANE kit and take it over to the evidence room instead of having to go to the hospital and all of that. So on site here at the Family Justice Center, we have several different partners, from our Child Advocacy Center and Child Protective Services to our nonprofit advocacy organizations, our healthcare providers and legal services, and also the YWCA that provides our children's supervision in the Children's Den. There's multiple off-site partners as well who come in and do credit counseling classes and those sorts of things. And we, in our first year, provided 417 integrated intakes. So those were the folks that walked through the door and were able to have one point of contact to connect with multiple services. 51% of them accessed more than one provider on their first visit. What we learned is that very often people want to come in and find out what their options are before moving forward and taking the next step. 84% of those folks identified domestic violence as their primary victimization, and 12% identified stalking or sexual assault as the primary victimization. We built the Family Justice Center with a goal of increasing victim safety. And after meeting with a Family Justice Center intake specialist, 92% of our survey respondents indicated that they had a plan to keep themselves safe and they knew what to do if they were in danger. 71% of survey respondents reported that they felt a decreased fear and anxiety level. So, we'd welcome you to take a look at our website, find out more about the work that we are doing in partnership with survivors and community organizations at the Buncombe County Family Justice Center. Our website is buncombecounty.org/FJC.
Thank you so much, Julie. That was a great presentation, and I love how you mentioned several times throughout that there was a lot of survivor input in the creation and design of your center, and I think that's really important. One question I have, what, in your opinion, makes your center unique?
You know, I think we're one of the great things about our Family Justice Center is that we had a really strong victim services organizations that were a part of creating the center. And while we are in a government-owned building, and my role as the coordinator is supported by our county Health and Human Services Department, the first point of contact for survivors for the intake at the Family Justice Center is our Domestic Violence Prevention Agency and our Sexual Assault Prevention Agency. Those are organizations that knew about client advocacy and empowerment work and were already providing great services. So now they are that first point of contact and help survivors get connected up to all of the other agencies that are in the Family Justice Center.
Oh, that's great. And that is very unique, because a lot of centers will use either usually staff from the domestic violence agency or volunteers. So that actually does make you very unique, that you're incorporating sexual assault staff too to do those initial intakes. That's great. As an affiliated center, you went through the whole affiliated process. Can you talk a little bit about if being affiliated has impacted your center in any way?
You know, I think that the Alliance for Hope has been a great support in this process. We were excited to have Casey and Gail and Michael come and do some strategic planning work with us to really ensure that as we built this community model, this coordinated Family Justice Center, that we were staying survivor focused, that we were staying victim centered and trauma informed, and really adhering to the best practices. As we do this work, it's helpful to have the learning experiences of other communities that have stumbled over some of the same stumbling blocks that we have, and had some successes and learning opportunities. So having that input has been great.
Oh, that's wonderful. That's good to know. And finally, just can you share a little bit about what direction your center is headed at this point? Do you have any plans for new programming or anything like that?
One of the pieces that I'm really excited about, and really it's, I think, one of the coolest things that I've been a part of in my career, it is our Still Standing project. Our Family Justice Center is focused on building a resilient community and changing the experience of domestic violence and sexual assault from one of shame to one of support. And we've worked with survivors who are willing to share their story to do a community-wide art installation we're calling the Still Standing Project. And it is life-size silhouettes with survivor stories that are posted in breweries. Asheville is Beer City, North Carolina, and libraries and shops across our community that sort of honor the strength and resilience that survivors have had. And survivors standing up and sharing their stories really changes the community conversation around domestic and sexual violence.
Wow, that's wonderful. Please keep us posted on that. That sounds great.
Absolutely.
Yeah, thank you so much for sharing your story and sharing your center with us all. And thank you to those of you who are listening and are going through each of the webinar series recordings. I hope that these recordings are helping you as a community looking to open a center or as a community that already has a center. So take care and stay tuned for more centers. Thank you.